Sarah Dunham. I'm an outpatient therapist. I work with Bloom Counseling in private practice. When I worked for DHHS, I loved doing that, and then went into the counseling program. And my last class was development across the lifespan, which got me interested in trauma and working with kids and how that's impacted them over the course of their lifetime. So from there, I just went into play therapy and was an intensive family preservation therapist for a while, going into the homes and working with families and helping maintain their households. Play therapy, the way I explain it to parents, it's not a lot of talking one-on-one, but it's a lot of allowing the kiddo to play out with toys. Maybe they're set out particular types of toys, but just play out the experiences that they've had, and help them find resolution through that play that they're doing. So it's facilitated by a therapist while they're processing through those experiences. When something happens that's traumatic to a child, it impacts their safety and security perspective about the world. And so when they have access to therapy, they're able to kind of play out those scenarios in their common language, which is play. And then they work through processing through that situation to help repair whatever damage was created within their security mind frame. Mm-hmm. And so when they work through that with a parent or somebody who's safe, it helps heal that, which impacts their risk of having mental health issues in the future, or higher risk of being involved in substance use or issues with relationships and things like that. Yeah, I think a lot of people don't struggle with the understanding of if they're not able to communicate, how are they able to have those processes of their experiences, which is why that play therapy comes into play. A lot of times people say well, they're so young, they don't remember anything, or they weren't in the room, they don't know what was happening, or they were asleep. But in fact, when something is happening in a child's life or something's happening in an adult's life, when a child is there physically or not physically, they experience that too. So a kiddo needs a safe place to be able to heal that process and make sense of what's happening in their life, to have some control over that for them. Some of the barriers I would say is just kind of we talked about the misconception of therapy, it's not going to be effective because they're too young, or they don't remember anything. So that's kind of a barrier with that. I would say also parents are kind of a big barrier sometimes, just because they might have had some past experiences with either the system or with therapists in the past, and so that kind of bleeds into how it's impacting their ability to bring kiddos for services or therapy. And just sometimes parents are going through their own thing, and they're just living day by day, and so it's hard for them to be able to bring kiddos to therapy or have the time, or transportation is a huge barrier at times. We work a lot with Medicaid here, within the child welfare system, but insurance is a big one. Therapy is not cheap, and so financial barriers can impact that too. But I would say really it's a lot of times it's the parents' experience, and a lot of times I'm spending a lot of time building rapport with the parent to help them buy into that and help their kiddo receive the services that they're needing. I would say feel comfortable as a therapist, feel comfortable as a provider coming in, or as a parent coming in, feel free to ask your child's therapist questions. We want you to be involved with your child's therapy. We want you to be involved with your child's treatment, and the relationship that you have with your child's therapist is just as important as the relationship that the therapist has with your child. So please feel free to ask questions. Please feel free to meet individually, have phone calls. You should be involved as much as possible, to be a part of that and to help in that healing process.